Question 1. A patient presents for a bilateral mammogram. Which modifier would be appended to the CPT code to indicate the procedure was performed on both breasts? A. LT. B. RT. C. -50. D. -59. Answer: C. -50. This question tests the correct use of CPT modifiers for laterality, which refers to the side of the body. The keyword bilateral is the direct clue that a procedure was performed on both sides of a paired organ, like the breasts or kidneys. The -50 modifier is specifically used to report a bilateral procedure, ensuring proper reimbursement by indicating that the service was performed twice. For instance, if a procedure is done on both the left and right knee during the same session, the -50 modifier would be added to the CPT code for that procedure. Remember this simple rule: if the service is identical and performed on both the right and left sides, think -50 for bilateral. Question 2. A patient is seen in the office for a painful, inflamed right great toe. The physician diagnoses the patient with cellulitis of the right great toe. Which of the following ICD-10 CM codes would be most appropriate? A. L03.116 cellulitis of unspecified toe. B. L03.031 cellulitis of right great toe. C. L03.032 cellulitis of left great toe. D. L03.039 cellulitis of unspecified great toe. Answer: B. L03.031 cellulitis of right great toe. This scenario tests your ability to select a diagnosis code with the highest level of specificity, particularly concerning laterality. The key terms in the documentation are right great toe, which requires a code that precisely identifies both the location and the side of the body affected. The code L03.031 is the only option that accurately captures cellulitis of the right great toe, whereas the other options are either for the wrong side or are unspecified. Always code to the highest degree of certainty documented by the provider to ensure accurate data and proper claim processing. A handy tip is to always match the anatomical site and laterality, right, left, or bilateral, in the documentation to the most specific code available. Question 3. What does the term nephrectomy mean? A. Surgical repair of a nerve. B. Surgical removal of a kidney. C. Incision into the skull. D. Visual examination of the colon. Answer: B. Surgical removal of a kidney. This question assesses knowledge of medical terminology, specifically surgical suffixes. The root word neph- refers to the kidney, and the suffix ectomy means surgical removal or excision. Combining these parts, nephrectomy directly translates to the surgical removal of a kidney, a procedure often performed for conditions like kidney cancer or severe damage. For example, a partial nephrectomy involves removing only the diseased part of the kidney. A great way to build your terminology skills is to learn common prefixes and suffixes, as they provide clues to the meaning of thousands of medical terms. Question 4. A Medicare patient is prescribed a standard manual wheelchair for use in their home. Which code set would be used to report the wheelchair? A. CPT Category I. B. ICD-10 CM. C. HCPCS Level II. D. CPT Category III. Answer: C. HCPCS Level II. This question tests your knowledge of the different code sets and what they are used for. The keyword is wheelchair, which is a type of durable medical equipment, DME. HCPCS Level II codes are used to report services, supplies, and equipment, like DME, ambulance services, and drugs, not covered by the CPT codes. For example, Code 1130 is a standard manual wheelchair in the HCPCS Level II codebook. A helpful way to remember this is to think CPT is for what the doctor does, procedures, while HCPCS Level II is often for what the patient gets, supplies and equipment. Question 5. A patient who has not been seen by Dr. Smith or any other physician in the same specialty within the practice for the past 4 years presents for an office visit. According to CPT guidelines, how would this patient be classified? A. New patient. B. Established patient. C. Consultation patient. D. Inpatient. Answer: A. New patient. This question tests the CPT definition of a new versus an established patient, which is crucial for selecting the correct evaluation and management (E/M) code. The key phrase is "not been seen" for the past 4 years, but the CPT rule specifies a 3-year look-back period. Since the patient has not received any professional services from the physician or another physician of the same specialty in that group within the past 3 years, they are considered a new patient. For example, if a patient last saw their family doctor on June 1, 2020, they would be considered a new patient if their next visit is on June 2, 2023. Remember the 3-year rule: if it has been 3 years or more since the last face-to-face service, the patient is new again. Question 6. A patient calls the billing office, angry that their insurance company was sent information about a sensitive medical diagnosis. The office manager explains this was necessary for payment. This release of information for payment purposes is permitted under which federal law? A. Stark Law. B. Anti-Kickback Statute. C. False Claims Act. D. HIPAA. Answer: D. HIPAA. This question is about understanding healthcare compliance and patient privacy regulations. The keywords release of information for payment purposes and sensitive medical diagnosis point directly to the Health Insurance Portability and Accountability Act, HIPAA. HIPAA's privacy rule protects patients' health information but allows for its disclosure for treatment, payment, and healthcare operations, TPO, without the patient's explicit authorization for each use. For instance, a hospital must send a patient's diagnosis codes to their insurance company to justify the services billed and receive payment. Just remember that while HIPAA protects patient privacy, it's not a complete barrier. It allows for the essential flow of information needed to run the healthcare system, especially for TPO. Question 7. A patient with type 2 diabetes presents with a new complaint of burning pain in both feet. The physician diagnoses the patient with diabetic polyneuropathy. How should this be coded in ICD-10-CM? A. Code G63, then E11.9. B. Code E11.42. C. Code E11.9 and G62.9 separately. D. Code R52 and E11.9. Answer: B. E11.42. This scenario tests your knowledge of ICD-10-CM combination codes, which capture 2 related conditions in a single code. The key is recognizing that diabetic polyneuropathy links the underlying disease, diabetes, with a specific complication, neuropathy. ICD-10-CM provides a combination code, E11.42, type 2 diabetes mellitus with diabetic polyneuropathy, that fully describes the condition without needing separate codes for the diabetes and the neuropathy. Using this single, more specific code follows the official coding guideline to use a combination code when one exists. Always check the ICD-10-CM tabular list for notes that indicate a combination code is available to avoid unbundling related conditions. Question 8. A surgeon performs a cholecystectomy. 2 days later, during the 90-day global period for the surgery, the patient returns to the office for a follow-up visit related to the surgery for a routine suture removal. How is this follow-up visit typically coded? A. Bill a low-level E/M service with modifier -24. B. Bill for suture removal separately. C. The visit is not billed separately as it is included in the surgical package. D. Bill a new patient E/M service. Answer: C. The visit is not billed separately as it is included in the surgical package. This question assesses understanding of the global surgical package concept in CPT coding. The key phrase follow-up visit related to the surgery during the 90-day global period signals that this care is bundled. The surgical package for a major procedure, with a 90-day global period, includes the operation itself, as well as all related preoperative and postoperative care, such as removing sutures or checking the incision site. Therefore, this routine postoperative visit is not reported with a separate E/M code because the payment for the original surgery already covers it. The takeaway here is to always remember that normal, uncomplicated follow-up care is part of the package deal for major surgeries. Question 9. A patient is seen by their physician to discuss their test results for a genetic carrier screening test. The patient has no symptoms and is concerned because their sibling has cystic fibrosis. What type of ICD-10-CM code would be used as the primary diagnosis? A. An external cause code from Chapter 20. B. A code for a confirmed diagnosis. C. A Z code from Chapter 21. D. A code for signs and symptoms. Answer: C. A Z code from Chapter 21. This question tests the appropriate use of Z codes, which report reasons for healthcare encounters other than a current illness or injury. The crucial clues are no symptoms and the reason for the visit is genetic carrier screening, which is not a disease. Z codes are used to capture circumstances like screenings, family history, or health status that influence a patient's health but are not a current illness. For this scenario, a code like Z14.1, genetic carrier status for cystic fibrosis, would be appropriate to explain why the service was performed. A simple tip is to think of Z codes as answering the why for the visit when the what isn't a current sickness. Question 10. A patient has a CT scan of the abdomen performed with contrast and without contrast. How should this be coded? A. Report two separate codes, one for the scan without contrast and one for the scan with contrast. B. Report the single CPT code for CT abdomen with contrast. C. Report the single CPT code for CT abdomen without contrast. D. Report the single CPT code for CT abdomen without contrast, followed by with contrast. Answer: D. Report the single CPT code for CT abdomen without contrast, followed by with contrast. This question tests knowledge of radiology coding conventions for contrast studies. The documentation with contrast and without contrast is the key to selecting the correct, comprehensive CPT code. The CPT codebook provides distinct codes for studies performed without contrast, with contrast, and a combined code for studies performed first without, and then with, contrast material. Using the single combined code is correct because it accurately describes the entire service performed and prevents unbundling, which is billing separately for services that should be reported together. For radiology, always look for a single code that captures the full scope of the study before reporting multiple codes. Question 11. For a service to be covered by Medicare, it must be considered reasonable and necessary for the diagnosis or treatment of an illness or injury. What is this concept called? A. Medical necessity. B. Prior authorization. C. The global surgical package. D. An advance beneficiary notice, ABN. Answer: A. Medical necessity. This question tests your understanding of a fundamental concept in billing and compliance. The phrase reasonable and necessary is the official definition of medical necessity, which is the overarching criterion for reimbursement from payers like Medicare. Medical necessity links a service, the CPT/HCPCS code, to a patient's diagnosis, the ICD-10-CM code, to prove the procedure was warranted. For example, an EKG is medically necessary for a patient with chest pain, but not for a patient with a sprained ankle. The key takeaway is that every service you code must be justified by the patient's documented condition to be considered medically necessary. Question 12. A patient is seen today for rehabilitation for aphasia, difficulty with speech, resulting from a stroke that occurred 1 year ago. In ICD-10 coding, what is the residual condition, aphasia, referred to as? A. An acute illness. B. A sequela. C. A complication of care. D. AZ code. Answer B. A sequela. This question tests the concept of coding for late effects, which ICD-10 refers to as sequela. The keywords are resulting from and the fact that the stroke happened 1 year ago, indicating that the aphasia is a long-term condition caused by a previous illness. A sequela is the residual effect that remains after the acute phase of an illness or injury has terminated, requiring 2 codes, one for the residual condition itself and one for the original cause, the sequela code. For instance, a scar from a burn is a sequela, where you would code the scar first, followed by the burn code with a 7th character S for sequela. Always remember that for sequela coding, you code the condition that exists today first. Question 13. An established patient sees their primary care physician for a regular checkup. During the visit, the patient also asks the doctor to evaluate and inject a painful cyst on their back. Which modifier should be appended to the E/M code? A. -24. B. -25. C. -57. D. -59. Answer B. -25. This scenario tests the use of modifier -25, which is one of the most common modifiers in outpatient coding. The key is that a significant, separately identifiable evaluation and management (E/M) service was performed on the same day as another procedure. The checkup is the E/M service, and the cyst injection is the separate minor procedure. Modifier -25 is added to the E/M code to tell the payer that the visit was not just for the pre-procedure work of the injection but was a distinct service. Think of modifier -25 as a signal that says, yes, these 2 services happened on the same day, but the E/M service was separate and went above and beyond the usual work for the procedure. Question 14. A pathologist examines a gallbladder specimen removed during surgery. The report states the pathologist performed both a gross examination, viewing with the naked eye, and a microscopic examination. Which type of service has been performed? A. Clinical pathology. B. Cytopathology. C. Surgical pathology. D. Molecular pathology. Answer C. Surgical pathology. This question assesses your understanding of the different branches of pathology. The keywords specimen removed during surgery and gross and microscopic examination are definitive clues for surgical pathology. This discipline involves the examination of tissues removed from living patients during a surgical procedure to help diagnose disease and determine treatment plans. For example, when a breast biopsy is performed, the tissue is sent to surgical pathology for examination to see if cancer cells are present. A simple way to remember is that surgical pathology looks at whole tissues, while cytopathology looks at individual cells, like in a Pap smear. Question 15. A Medicare patient wants to have a cosmetic procedure that is not covered. The provider explains that the patient will be financially responsible for the entire cost. What form should the provider have the patient sign before the procedure to document this? A. Patient intake form. B. HIPAA notice of privacy practices. C. Assignment of benefits. D. Advance beneficiary notice of non-coverage, ABN. Answer D. Advance Beneficiary Notice of Non-Coverage, ABN. This question tests your knowledge of a key Medicare compliance document. The crucial information is that a Medicare patient wants a not-covered service, and the patient will be financially responsible. An Advance Beneficiary Notice of Non-Coverage, ABN, is a written notice given to a Medicare beneficiary before providing services that are not expected to be covered, formally informing them that they will have to pay out of pocket. This protects the provider by ensuring they can collect payment from the patient for non-covered services. A good tip is to think of the ABN as a financial heads-up for the patient, ensuring there are no surprises when the bill comes. Question 16. A patient is treated in the emergency department for a deep laceration to their right forearm. The ICD-10-CM code for this injury requires a 7th character. Since this is the patient's first time being seen for this injury, what would be the appropriate 7th character extender? A. Initial encounter. B. Subsequent encounter. C. Sequela. D. Subsequent encounter for fracture with delayed healing. Answer: A. Initial encounter. This question tests the proper application of the 7th character extenders for injury codes in ICD-10-CM. The key is that this is the patient's first time being seen for the injury, which directly corresponds to an initial encounter. The 7th character A is used for each encounter while the patient is receiving active treatment for the condition, such as the initial emergency department visit, surgical treatment, or evaluation by a new physician for the same injury. For example, even if the patient sees a specialist the next day for the same laceration, it is still considered an initial encounter because active treatment is occurring. Remember that initial encounter refers to the entire period of active treatment, not just the very first visit. Question 17. The CPT codebook has modifiers for laterality, LT and RT. HCPCS Level II also has modifiers for laterality. A podiatrist trims the nails on the great toe of the left foot. Which HCPCS modifier would specify the digit? A. LT. B. F5. C. TA. D. T5. Answer: D. T5. This question tests your knowledge of the highly specific anatomical modifiers found in HCPCS Level II, which go beyond the simple LT, left, and RT, right. The key information is great toe of the left foot, which requires a modifier that identifies the exact digit. HCPCS includes T modifiers, T1, T9, TA, to specify which toe or finger was treated. T5 is designated for the left foot, great toe. For example, if a procedure were done on the right foot's second toe, the modifier would be T1. This highlights the need to be familiar with both CPT and HCPCS modifiers, as HCPCS often provides a higher level of anatomical detail, especially for hands and feet. Question 18. A surgeon performs a complex procedure on the small intestine that has never been done before, and there is no CPT code that accurately describes it. How should this service be reported? A. Use the CPT code for the most similar procedure. B. Do not bill for the service. C. Use an unlisted procedure code from the appropriate section of the CPT book. D. Use a miscellaneous HCPCS Level II code. Answer: C. Use an unlisted procedure code from the appropriate section of the CPT book. This scenario assesses the correct process for coding a procedure that is not described by an existing CPT code. The keywords "no CPT code that accurately describes it" direct you to use an unlisted procedure code. Each section of the CPT manual has unlisted codes, e.g., for 4799, unlisted procedure, intestine, that should be used when a specific code is not available, and it must be submitted with a special report explaining the procedure in detail. Using a code for a similar procedure is incorrect and could be considered fraudulent. The key takeaway is, if you can't find a specific code, don't guess, use the designated unlisted code and provide clear documentation. Question 19. A medical report describes a patient's injury as being on the anterior surface of the thigh. What does anterior mean? A. Toward the back of the body. B. Toward the front of the body. C. Farther from the trunk of the body. D. Closer to the midline of the body. Answer: B. Toward the front of the body. This question tests knowledge of basic anatomical directional terms, which are essential for accurately interpreting medical documentation. The term anterior, or ventral, refers to the front of the body or a body part. In this case, anterior thigh means the front of the thigh. An easy way to remember this is to connect anterior to ante, as in a poker ante that you put in before or at the front of the game. Correctly understanding these terms, like posterior, back, superior, above, and inferior, below, is fundamental to selecting the right code. Question 20. The practice manager for a large physician group regularly reviews a sample of medical records and corresponding claims to ensure that coding is accurate and compliant with regulations. What is this internal review process called? A. Credentialing. B. An audit. C. Revenue cycle management. D. Accounts receivable. Answer: B. An audit. This question tests your understanding of compliance and quality assurance processes in medical coding. The key activities described: reviews a sample of medical records and ensure that coding is accurate and compliant, are the definition of an audit. An audit is a systematic review of claims and documentation to check for accuracy, identify areas for improvement, and ensure adherence to payer rules and regulations. For example, an internal audit might find a pattern of incorrect modifier use, leading to staff retraining. Remember, an audit isn't just about finding errors, it's a critical tool for education and maintaining a healthy, compliant practice. Question 21. When a 6-character ICD-10-CM code requires a 7th character for an extension, e.g., for an initial encounter, but the code itself only has 5 characters, what is used to fill the empty 6th character position? A. The number 0. B. The number 9. C. The letter X. D. The letter Z. Answer: C. The letter X. This question tests a specific and important convention in ICD-10-CM coding structure. The key is understanding how to correctly format a code that needs a 7th character extender but is not long enough. The letter X is used as a placeholder to fill in empty character spaces when a code needs a 7th character but does not have a 6th. For example, the code for a toxic effect of venom from a black widow spider, accidental, is T63.311, but it requires a 7th character. To add A for an initial encounter, you must use X as a placeholder, making the final code T63.311XA. Just think of X as the placeholder that X marks the spot where a character is needed to make the code valid. Question 22. An established patient has a 25-minute office visit where the physician counsels them about managing their chronic hypertension and diabetes. More than half of the visit was spent in counseling and care coordination. According to CPT guidelines, how can the level of E/M service be determined? A. Only by the number of diagnoses managed. B. Only by the complexity of medical decision-making. C. By the total time spent on the date of the encounter. D. This type of visit cannot be billed. Answer: C. By the total time spent on the date of the encounter. This question tests the rules for time-based billing for outpatient evaluation and management, E/M, services. The crucial clue is that more than half of the visit was spent in counseling, which allows time to be the controlling factor for code selection. For outpatient office visits, Coders can select the E/M level based on either the total time spent on the encounter day or the level of medical decision-making, MDM. When time is used, it includes all time spent by the provider on that date related to the visit, such as preparing, seeing the patient, and documenting. A simple tip is to remember that if the documentation supports it, time can be a straightforward alternative to MDM for choosing your E/M code. Question 23. A coder notices that CPT code 11042, debridement, subcutaneous tissue, is listed as a column 2 code to CPT code 11043, debridement, muscle and/or fascia, according to the National Correct Coding Initiative, NCCI. What does this relationship typically mean? A. The two codes can never be reported together. B. Code 11042 is considered a component of 11043 and should not be billed separately. C. Code 11043 should only be billed if 11042 is also billed. D. The two codes are for different body systems and are unrelated. Answer: B. Code 11042 is considered a component of 11043 and should not be billed separately. This question assesses your understanding of NCCI edits, which are automated prepayment edits used by Medicare to prevent improper payment. The keywords column 2 and component are central to understanding these edits, which bundle services that are typically included in a more comprehensive procedure. In an NCCI edit pair, the column 2 code is considered part of the column 1 code and is not separately payable unless a specific modifier is allowed and appropriate. For instance, debriding subcutaneous tissue, 11042, is an integral part of debriding down to the deeper muscle, 11043, so you would only report the more extensive procedure. Remember the NCCI rule: you can't bill for both the whole and a part of the same service. Question 24. A new medical device for monitoring blood sugar has been approved by the FDA but does not yet have a permanent CPT code. It is being used in several research studies. Which type of CPT code would be used to report the use of this emerging technology? A. Category I CPT code. B. Category 2 CPT code. C. Category 3 CPT code. D. Unlisted procedure code. Answer: C. Category 3 CPT code. This question tests your knowledge of the different categories of CPT codes. The key phrases new medical device and emerging technology point directly to Category 3 codes. These are temporary, alphanumeric codes, e.g., 0715T, used for tracking new and developing technologies, services, and procedures to help collect data for future FDA and CPT coding consideration. Unlike unlisted codes, Category 3 codes provide a specific way to report a new service, which aids in data collection and analysis. A great way to remember is to think of Category I as proven procedures, Category 2 as performance measures, and Category 3 as temporary or trial technologies. Question 25. A patient is treated for a fracture of the ankle after slipping on a wet floor at a local grocery store. In addition to coding the fracture, what other type of code should be assigned to provide data about the injury? A. AZ code for follow-up care. B. An external cause of injury code. C. A procedure code for cleaning the floor. D. A code for wet floor syndrome. Answer: B. An external cause of injury code. This scenario tests the use of external cause of injury codes, V00Y99, which are used to provide supplemental information about an injury or health condition. The key details are how and where the injury happened, slipping on a wet floor at a local grocery store. These codes are never sequenced first but are used to report the cause of the injury, e.g., W01.0XXA, fall on same level from slipping, tripping, and stumbling without striking object, initial encounter, and the place of occurrence, e.g., Y92.511, Grocery store as the place of occurrence of the external cause. Think of external cause codes as the storytellers that answer the who, what, where, and why of an injury, which is valuable for public health data and injury prevention research.